The increasing number of COVID-19 cases has made it necessary to look at how patients of the virus are being handled and managed at various treatment centers in the country. Recently, there were allegations of incessant violation of rights of patients at treatment centers in some parts of the country, leading to protests and even abandonment. The National Human Rights Commission has stepped up to check and address the situation. Well, the Commission released a set of standards, or rather standard guidelines, for the protection of rights of COVID-19 patients at treatment centers across the country. The Executive Secretary of the Commission, Tony Ojukwu, said the guidelines were issued in line with the mandate of the Commission to protect and promote human rights in accordance with its Establishment Act. The new guidelines also states that any person who tests positive for COVID-19 should be entitled to a prompt notification of the results of such tests, not more than 24 hours after the test has been done. And no patient shall be subjected to discrimination on grounds of ethnicity, tribe, state of origin, nationality, religion, social status, gender, sexual orientation, disability, age, political affiliation, or any other grounds as provided for by the 1999 Constitution of the country. Now, what proper ways should these patients be handled? How can some of these matters arising be addressed? This will form part of our discussion on Nigeria Today. I am Anne Jibuno. Welcome to the program. And joining us on the program is Dr. Isaac Egboja. He's a public health expert. Welcome to Nigeria Today.
Hello, good evening.
Now, what's the first thing one should do if someone close to you has COVID-19, if you discover that someone close to you has COVID-19?
Okay, what NCDC did was to put out telephone lines through which you can reach them and inform them of such a case. If, however, you are unable to get through to their number or to get a response from them, and you have a relative that has symptoms that you suspect could be COVID-19, you, the healthy person, could make more effort to go out and inform NCDC. If that fails, you can contact the nearest health center and inform them about the person.
Now, how can these patients or the people with COVID-19 be handled so as not to infringe on their fundamental human rights, especially when you discover they have this virus?
Okay, that's handled by health workers?
No, the first point of contact, that's the relatives, then the health personnel then.
Okay, relatives, let's start with relatives, with a lot of caution. If a member of the family, for example, comes down with symptoms, coughing, fever, headache, chest discomfort of any type, difficulty in breathing, you need to keep the person in a separate room, isolate the person, and make all efforts to inform NCDC of your state, or if you're in Abuja, here at the national level. There are telephone lines all over the place now that you can reach them. But like I said earlier, if for any reason you try, and it is possible, and people have complained about this, that they tried and they were not able to get through to the lines. If you try and you're not able to get through, you as a relative would have to go out and report that you have a person in your house or your office, wherever it is, with symptoms that make you feel concerned that it could be COVID-19. Now, you should not go handling the patient. You should not go trying to treat the patient. You should not go trying to move the patient yourself. Because by doing that, you endanger your own life. You will get infected.
Okay, how about the health officials?
Okay, for the health officials, there are three things that any health worker takes into account when handling a patient. The most important one is the safety of that patient, because that's the reason why they are there in the first place, the health of that patient. The number two thing that they do is the comfort of the patient. And then the number three is the dignity of that patient.
And that's
those three things are important, but the most important is the safety of the patient, because that's the real reason why health workers are there.
All right, we've heard reports of patients absconding or running away from isolation centers. We've been told to call them treatment centers. Anyway, running away from these centers, what basic facilities should these centers have?
Okay, now it is very difficult for me to sit here and tell you that they should have this.
Well, just the basics, maybe.
But there are guidelines that have been given to the states and to health facilities and to those who are operating those isolation centers. The minimum comfort of the persons is required. What I mean by minimum comfort is they should not be in a place where they are standing up, there's no seat for them, or where there are seats but in the night there's no place for them to sleep. That will not be ideal. What is ideal is that there should be a bed, at least, if nothing else, for them to lie down and to be comfortable. There should be toilet facilities. There should be running water. And then, most importantly, there should be somebody there with them to talk to them, to counsel them. What I have seen in, like the case in Bauchi or Gombe, which one was it? Gombe, where the patients or the people in the isolation center came out in rebellion, more or less. Maybe happened because nobody talked to them the way they should have been talked to. Nobody handled them the way they should have been handled. I don't know the details. I'm only speculating. But whatever the case is, when you get people into that kind of facility, you need to talk to them. You need to counsel them. Don't forget that these are people from various backgrounds put in the same place, and they will not be comfortable with each other. So there are some of them who are already sick, or who have already manifested the symptoms, and there may be some of them who are positive, but who are okay otherwise. Okay. Now, they will look at themselves as being different. Those that are not manifesting anything but they are positive will be looking at those who are sick as those who are really the patients, and they are not the patients. And you don't blame them. But whatever the case is, the most important thing is before you take anybody into an isolation center, and when they arrive there, you should counsel them, you should talk to them, and make them as comfortable as possible. If, for example, you put them in an isolation center where there's no toilet facility, I'm giving an example, that will not be ideal. If it is in a place where there is no water for them to wash their hands, which is what we are preaching, that will not be ideal. If there is no water for them to drink when they are thirsty, that will not be ideal. If there is no food for them to eat at all, that will not be ideal either.
Okay.
If it is cold, if the weather in the place is cold, and you leave them exposed to the cold, that will not be ideal either. The reason why I started by saying it is difficult to specify is if you go to the north at this time of the year, it is very hot. If you go to the south, it is cold. So the situations are different, but basically the comfort of the people is required. The dignity of the people is required. And of course the safety. There must be security around them. That is very key.
Now let's look at what the Human Rights Commission came up with recently about guidelines, regarding the rights of these patients. We were told, they said we should stop referring to these centers as isolation centers. We should call them treatment centers. You are a medical personnel. How does this in any way take away from, medically? Does it take away anything from it?
No, medically it doesn't take anything away. It's just the nomenclature, the name. Whether you call it an isolation center or you call it a treatment center, basically you're going to do the same thing to these people who are there. But if, however, socially, treatment center is more acceptable, why not? There's nothing wrong with that. One of the things that we need to keep in mind, and all those who are involved should also keep in mind, is that there are some patients or there are some people who have tested positive for COVID-19, but they have not come down with any serious symptoms. We say they are asymptomatic, meaning they are not without any symptoms, or they are without any symptoms. Okay, now those people should not regard themselves as being well. As far as the medical person is concerned, they are patients.
Okay.
And they should be looked after, they should be cared for. Why? Because the symptoms could come down at any time. I mean those now who are isolated.
Okay.
Point number one. Point number two, they can infect other people who are around them. And that is very important, because I've heard people complaining, and some of them complaining, I'm okay, I don't have fever, I'm not coughing, I don't have any chest pain, I don't have any problem. But they have tested positive, and the health staff has explained to them. This is where counseling is very required. This is where good communication is very required. You should let them know why they should be isolated, the danger they pose to others around them, and the fact that even if they were allowed, for example, to stay at home, there's no guarantee that the symptoms cannot come down at any time.
Okay.
So they are better off being observed.
All right, let's look at the centers across the country. You've read and probably seen some of them. What do you think? Are they really up to standard?
Most of the ones that I have seen are okay. Most are okay. I have not gone around to see them, so whatever I am saying should not be taken to be 100%.
Okay.
Some of the ones that I have seen are as good as any small hospital, small clinic, dispensary. Because basically that's what isolation center really is. Okay. Now, you don't expect to be as comfortable in such place as you would be in your own house.
Yes, and it takes me to the issue about private hospitals. Some of them have been added to the list of hospitals managing COVID patients. Do you see them meeting the criteria?
Well, the Minister of Health has repeated this over and over and over, that before any private institution, any private hospital is allowed to treat COVID-19 patients, that hospital has to be certified. That hospital has to be inspected. Those who are going for inspection know what to look for. If they find that the hospital does not meet the requirement, they will not approve. That I can tell you, they will not approve.
All right, let's pause here for some messages. The conversation continues shortly. Do stay with us on Nigeria Today. Thanks for staying with us. Our focus on the program is on handling and managing of COVID-19 patients. And our guest is Dr. Isaac Eboja. He's a public health expert. Now, Doctor, let's talk about funding pools for, we're talking about the private sector before, the break. Funding pools, are there funding pools for private, especially private sector private hospitals managing COVID patients? Should there be, or are there tools for this? Do they get support from government, or is it just their regular capital? Because I say this because they have to feed them. You know, you mentioned so many things that they need to criteria they have to meet.
Yes. Well, anytime a patient is treated, somebody picks up the bill. There has to be somebody that will pick up the bill. And I'm sure when the Minister of Health said that all private hospitals that want to treat COVID-19 patients should be inspected and approved before they do, I'm sure he has all those things in mind. And there's an arrangement between the Federal Ministry of Health and such institutions. I do not believe that the institutions or the hospitals will be left on their own, because at the end of the day, somebody will pick up the bill of that patient.
Okay. Let's
However, let me come.
Okay.
If, for example, a particular health facility has been approved and a person is taken to what you call the government isolation center or treatment center, as you call it now, and the person decides, no, I would want to have my privacy, and therefore I would want to go to social hospital that is already approved for treating COVID-19 patients. That is the person's choice.
Okay, so it shouldn't attract more money.
I'm not the one to decide.
All right.
I think that those health facilities will decide, because I can tell you that no health facility will treat a patient free of charge, because if they do, they will run out of business.
Okay, let's look at the issue of results. Some have heard reports of delayed results, and even the National Human Rights Commission is saying 24 hours should be the time, you know, within which you get your results. What's the situation now?
I think that we should commend NCDC, whether at the Abuja level or the state level. They are trying, they are doing their best. The turnaround time has improved drastically. When we started in March, and samples were sent from one state to the other, it took a longer time. For example, here in the North Central, a sample, say from Kogi or from Benue or from Nasarawa sent to Abuja will take a longer time because of the turnaround time. Now, many of these places have test centers that are close to them. Therefore, as soon as the sample is collected and the result is ready, they will get it out. They don't have anything doing with the result. They won't keep it for fun. There's nothing they will do with it. In fact, the earlier they push out the result, the better for them, because more samples are coming in. And so they don't have any pleasure keeping anybody's result. When you say 24 hours, I hope that
the Human Rights Commission
yes, I hope that people don't take it literally as a legal yardstick, because there could be a situation where, for example, or hypothetically, samples are collected in the lab. Either the numbers are many or the tests have been done, but getting it out to the person takes a little bit longer than 24 hours. What we should emphasize is that there shouldn't be a long period of delay. But if you say, once it is 24 hours, at the 25th hour, I can sue you, then you're not making sense. And it means, too, that you don't understand what these people are going through.
Certainly. Let's look at the issue of stigmatization. Now, how is Nigeria faring in that area of COVID-19 patients, especially those who have left the treatment centers?
I think we are improving. We are doing better than I personally thought we would do. People are trying to understand, and the more we talk to them, to people, to the public, the better they understand, the more they cooperate with us. If no communication has taken place, for example, by now, anybody that they hear has had COVID-19, people will run away from the person. But you can see one of the things that I like. Let me give you a good example. The governor of Kaduna State, when he tested positive, he said it, he announced it himself. He didn't wait for somebody else to say, he said it himself. Give it a very good example. The same guy, the same governor, when he recovered and came out, he announced it also. And you see him in the public. And you see that he is strong, he is well, he is doing his duty. Boris Johnson, the Prime Minister of England, did the same. He's back to the office now, he's working. So, people, these are good examples for people to know that the fact that you have COVID-19 doesn't mean the end of the world for you. And it doesn't mean that you carry the disease that wherever you go, you will still infect people. When once they have tested once, twice, or maybe even up to 3 times, and you've tested negative, it means the virus is no more inside you. And therefore, you are as good and clean as any other person. However, such person would still have to take very good care of himself or herself. But I'm impressed by the way people are beginning to understand that 1, COVID-19 is not a death sentence. 2, we should not stigmatize anybody. We should not run away from anybody that has had the disease.
Yes, you said something about taking care of themselves. So what do you mean? The COVID-19 patients,
yes.
Very briefly.
Yes, because let there be no belief that because you've had it before, you cannot have it again. We've not yet established whether you can be reinfected. Ordinarily, most viruses, if you have been infected, you develop immunity, and therefore you are not likely to be reinfected by the same virus again. But COVID-19 is still new. We are still studying. And nobody really understands it very well. And therefore, whether those who have recovered can still test positive or can still be infected.
You're not very sure.
It's not very. In fact, I have heard of a case of somebody, at least last week, of somebody who, not in Nigeria, who was discharged from the hospital, who went home, and weeks after, the person tested positive
again. Okay, let's, okay, well.
So I don't want those type of people to believe that because I've gone through it, I can never get it again and go without wearing face masks, without observing the rules.
You have antibodies.
And I'm already protected. No, let them not do that.
All right. Now, is it, can a patient decide not to go to an isolation center? Maybe he wants to isolate at home. Do you see this ever happening? You know,
those are 2 different questions. Let me take the first one. Can a patient decide not to go to an isolation center? Yeah. The answer is no. Capital no. And I'm glad the Secretary to the government explained this evening. When the president gave conditions that would be for the observations or for us to observe, part of that is the fact that if you test positive, you have to surrender yourself for treatment. And one of the things that the president said too is that you are right as an individual ends where somebody else's own begins.
Yes.
The fact that you test positive and you feel you don't need to be treated.
No, not that he doesn't want to, he doesn't need treatment. He wants to self-isolate.
That's a separate question. Let me finish this one. I'll come to that one.
Time.
That fact, you don't have the right to decide that you should not or you will not go to an isolation center. You don't have that right.
All right.
Okay. Now the second point, if you think, well, we have not gotten to that point, and this evening too, the DG of the NCDC answered the question on this issue. We are getting to that point where the treatment centers, as we call it now, or the isolation centers will be saturated to a point where some people may have facilities where they can be looked after.
All right.
We are getting to that point. We have not reached there yet. If we get to that point, those in authority will decide what would happen and the condition that you would have to meet for you to be allowed to stay in your own preferred place for treatment.
My next question is a yes or no answer. The National Human Rights Commission has said any patient whose rights is trampled on can, seek redress in court. What do you think? Do you agree with this or don't you at this time?
It depends on your definition of
redress.
Yes. No. Of what you mean by your right being violated.
Okay.
It depends on what you mean. If, for example, the one we just mentioned about, if you test positive and they tell you that you have to go to an isolation center or treatment center and you say no, you don't have right. If they come and take you by force, you cannot sue anybody.
Okay, then any other thing you can sue.
Any other thing like what?
All right. If it's your rights are actually being trampled on, you can sue.
Like what? No, we need to know. I cannot tell you. Yes, you can sue.
Completely out of time.
You need to know what it is that they have done to trample on your right. The definition has to be known. Because I don't want to misguide people to think that they have the right now to be suing people because they have been told to be treated. Okay,
well, maybe we'll pick it up from here next time. Thank you very much, Dr. Isaac Egboja, for joining us here today.
My pleasure.
Public health experts. And this is where we wrap up on this edition of Nigeria Today. Thanks for staying with us.